Hey, welcome back in, all you DPC rebels and resistant fighters. Dr. Shane back with another Friday 5-minute magic tip. Hope you guys saw the one I did last week because this is a two-part series. I'm going to dive into part two of what we talked about last week. Will the real DPC please stand? So we started off last week talking a little bit about some DPC fakes out there, some DPC in name only, some dinos, some copies of direct primary care. Talked a little bit about that, some frustrations we're hearing from around the country from DPC physicians with clinics that are opening up and trying to be like DPC, but not really having the philosophy or the real mindset of DPC, seeing more and more of that happening. And so what can we do about that? What should we do about that? How do we continue to push forward with our purpose and our mission in direct primary care? So I want to talk a little bit about that today from a doctor standpoint, from a benefits advisor, insurance advisor standpoint, and a little bit from the employer side. So let's hit it from all three angles today. So first of all, for the docs, for physicians out there, you're considering DPC, or maybe you have a DPC and you're seeing these fake type DPC clinics that are opening up near you that don't have the same mission or vision. Obviously, we living in America, the capitalism will reign, so you're going to see people try to copy these things. Anything that's good, any service that's awesome, any little widget or gadget or some kind of awesome piece of equipment that somebody invents or creates, people are going to try to copy those and sell them for cheaper, or just the capitalistic way. So don't give up. The big thing is don't give up. Don't panic. You have your mission, you have your vision, you keep pushing forward, keep your DPC mindset going. Think about, go back and revisit your mission, your purpose, what you're doing, what you're doing. Keep the focus on that. Do good medicine. That's a critical thing. You do what's best and right for the patient. Make your medicine good. Make your practice good. Do the things that people need in your community. Access and time. Speak the truth whenever you're out talking. Just be real with people and speak about what true DPC is and what you feel your vision is when you go out and meet with the community. Continue to educate your community on direct primary care, what that looks like. It's been around for 20 years. So what is the mission and vision of the whole philosophy of direct primary care? Continue to educate that on your social media, on your website, your patients, your community, anytime you get a chance to talk about direct primary care, what you do. So, have hope there. Hang out with other DPC docs in your community, and you guys, form strong bonds and help each other out. Advisors and brokers, what do you need to be doing about this? Obviously, educate yourself about what's going on in your community. And when you see new clinics open up, okay, what are they all about? What's going on here? Who owns the clinic? Who is managing the patients? Is it a physician? Is it a primary care physician? We're seeing all kind of things where non-physicians are owning clinics. Big corporations are owning clinics. So what's going on with this new clinic in your area? Meet with DPC docs in your area to learn what they offer and how they operate. Go to DPC events, direct primary care events where doctors are at. Meet those doctors, hang out, get the vibe, get the philosophy, begin to understand how that works. Sign up with a DPC in your area. As a advisor, if you're going to eat your own dog food, you should be seeing a DPC physician as an advisor. So take your family to a DPC physician so you understand the philosophy and the mindset of direct primary care, so you can share that with employers, share that with people in your community. If you're an employer, a business owner, CEO, what do you need to do? How do you need to learn about this or fight with this or wrestle with this issue of fake DPC in your community? Again, it's about learning and education, partnering with a good advisor who knows about the DPC community is also helpful. If there's DPC docs in your community, certainly meeting with them, doing a meet and greet, looking at their office, learning what you can from their office. Ask the tough questions. Those are the big things. What are the tough questions you can ask to really get to the bottom of it? You know, who owns the practice? Who are the physicians here? Are there physicians here? Who's taking care of the patients? What kind of board certification do they have? If they're board certified, are they family physician? Are they internal medicine? Are they pediatrics? So lots of tough questions you can get to, you know, finding out what kind of services they provide at the clinic. You know, can they do procedures there? How detailed can they get to help your employees to lessen referrals, lessen urgent care visits? So just ask to meet with them and ask the tough questions to get a feel of if this is a legitimate direct primary care clinic that can really help you, or is this some fly-by-night, just trying to make a buck type of clinic, and there's no physician there. The people who own it are physicians. You know, it's starting to sound a little bit shady here. So those are some things you can work on and think about as time goes by. If you begin to see these DPC and name-only type clinics open up. So begin to watch for it, think about it, have hope, you know, stand together with other DPC physicians. That's what the DPC Alliance is all about, national organization really to support other DPC physicians. It's a DPC, it's a physician-only organization. So, you know, be a part of that, get involved there, connect on all their social media platforms, and let's just continue to lift each other up. Hope to see you guys back next week with another Friday 5-Minute Magic Tip. You guys hang in there, keep the hope going. That's all we have these days. We're just going to continue